welcome to Life Matters with Judith A. If this is your first time tuning in, thank you and welcome. I encourage you to subscribe to the channel, like the videos and share them with your friends. Now, if you are a returning guest, you know that I really appreciate you coming back. Continue to send me your comments, feedback, so that I can make this useful to anyone who takes the time to tune in. So thank you for joining me today. I will be talking about screening mammograms. Screening mammograms simply is scheduling to get your breast checked when you don't have any concerns. You're not feeling any lumps, you don't have any pain in some specific area and stuff like that. But you're just coming in to say, I want to check my breast to be sure that I have nothing growing in there. That is screening mammograms. And for that, we take at least 2 pictures or 2 images on each side of the breast, different angles. Now that depends on the size of your breast. If you are an average sized woman, average sized breast, we take at least 2 pictures on each side. Like I said, different angles, we're done. If you are well endowed, we might need to take additional images to cover the entire breast tissue. There are also some women who are not large, or are well endowed. However, they have dense breast tissue that goes all the way almost into the armpit. And for such women, we take additional images so that your breast tissue is seen in 2 planes, a 90-degree and anywhere from 35 to 60 something degrees. Okay, so the breast is seen in 2 planes depending on your height and depending on your body habitus, meaning whether you're tiny or large chested. We as technologists know what angles to use to get the images that we need to get. So if you are a woman who is well endowed, it is very likely that we are going to be taking more than 4 images, because the goal is to cover the entire breast tissue. So if we need to take, let's say, 3 images as opposed to 2 on each side, we'll do it. For the most part, the technologists will tell you why they are doing any additional images. At least that's what I do. There are times when somebody will come in, average sized woman, and I will take 2 images on each side, but I realize that the nipple is slightly tucked under, so the nipples are not sticking out. In other words, the nipples are not in profile. You want to get at least 1 image. That is the standard. At least 1 image with a nipple in profile. So that if there's anything hiding behind the nipple, it will be detected, because the nipple is thick and could be covering something. So you can come in with barely any breast tissue. If we need to do an additional image, we will do that. And your technologist should be communicating with you. It's part of our jobs to do that. Now, when you come in and you have breast implants, just for starters, we're going to be taking at least 4 images on each side of the breast. 4. Why is that? For the first set of images, which is the first 2 and 2 on each side, we take it with the implant in place. And then we take a second set of images where we displace the implant. It sounds gruesome, really, but it's not. We just push the implants out of the way and we get a good compression off the breast tissue. Your implants are not going to be ruptured from getting a mammogram. It's not. I have not heard anybody that I have worked with closely causing rupture of the implants from getting a mammogram. It hasn't happened. When I have patients who are coming in for the mammogram for the first time and have implants, sometimes some are so anxious, and I understand. I do my best. I take every opportunity to give a little bit of share, a little bit of my knowledge in what I do. So by the time I'm starting the exams, my patient is assured that I am not going to rupture your implants, but it's important that we cover the entire breast tissue. So hopefully I have been able to shed some light on what screening mammogram is about. Don't be afraid to get in for a screening mammogram. Like I have said in the past, from ages 40 and up, unless you have a strong family history, a mother or sister have had breast cancer, then you start your screening mammograms 10 years sooner. Please don't forget that. It's very important. Now, depending on which facility you go to, there are some places that a doctor looks at your mammogram whilst you're there, they tell you your results. In certain places you leave, your result is sent to you. Now with my chart, reports are sent into my chart the moment they are read. So I like to tell my patients that the doctor is not here to look at your images right away. And so if they find anything that needs further looking into, you will be called back. And that is what is considered a diagnostic mammogram, among other things. We will talk about that in later episodes. So I hope I've been able to shed some light on screening mammograms with you today. Go ahead and schedule your exams if you haven't had any in the past year. Things can happen quickly. I had a patient who had her last mammogram 2021. She came back and there was a cancer in her breast. Folks, if you encounter anybody who's had breast cancer before, you will know that it's not a joke. It takes a whole lot from you. So, but if it is detected early, your chances of survival is really high. Some go in, get the cancer taken out, and they don't have to even have chemo or radiation, depending on what stage it's found. So screening mammography is very important. I'm a broken record, yes, I admit it. I will keep hitting it, this importance of getting your screening mammograms done, and hopefully I'm saving some lives. Thank you so much for joining me. Until I see you next time, take care of yourselves, be kind to yourself and to others. God